Welcome, everyone, to the Transformation Nurse Academy podcast. This is our weekly episode, Talk with Kevin, where we cover topics for all nursing fields with extra emphasis on emergency and critical nursing. Get ready for candid discussions that explore the vast landscape of nursing and beyond.
All right, welcome everybody. This is Kevin from the Transformation Nurse Academy podcast, and I have Nelly ShiningLight here with me. How you doing, bitches? Not you, Nelly, because you're not a bitch, but the rest of you, fuck you, motherfuckers. Welcome, Nelly. Nelly's an oncology nurse, I believe, and I don't know where you work. I know you told me, but I forgot. So remind me where you work.
I currently work for the government, and I
Do
also
you
work
really?
for Kaiser.
Wait, what do you do for the government? I better get
I
off
do
this shit.
oncology for the government as well.
You work at the fucking VA? Oh, she don't want to say
Am I
shit.
supposed to say something?
Yeah, but you say the government, now you're making my stomach hurt. Are you trying to turn on me or something? You reporting me?
No,
I'm more scared of the government than I am my wife, Nelly.
but I do work for the government,
I got
and
you. All right, all
I
right.
do work for Kaiser,
Oh yeah. Well,
which is
I
not
always make fun
supposed
of.
to say, right?
No, well, I told Michael I was a little upset with your boss. I kept calling her Ruth, but it's Cheryl,
Oh, Cheryl, yeah,
right? She's your CNE, Chief Nursing Executive at Kaiser, right? She says she's way up there.
yeah. Which Cheryl are we talking? Our
The
speaker,
one that,
our presenter?
the one that did the tumor lysis. Like
Yes,
she's way the
yes,
hell up there, right?
yes. She
I
is.
think she's
She's
like one
our
step below the CEO.
something like that, but she's
And I told her,
pretty.
yes, I went there and I said, why won't you let me interview you? She's like, I don't want to be famous. I'm like, really? You're already famous. So quit that shit, Cheryl. I liked her speaking and I told her,
Her
don't be offended.
presentation.
Yeah, I liked hers the best because it reflected to me in the ER. I would probably see that more than anything in the ER. There was a guy named Mark Stevens. He's a flight nurse, works in the ER. He said a day after I posted the interview with Pete, he said he saw that in the damn ER that night. I'm like, holy
Oh.
shit, we were just talking about that. So, but I was trying to get her to come on, but she wouldn't do it. Tell us again one more time. Tell us your name, where you work, and how the hell did you get the name ShiningLight? Because I know everybody's going to ask that because somebody already asked me that once already. I know you get tired of people asking you that shit, but
So my name is Nelly, and I have been in oncology for now going on 7 years this upcoming March. And on my Facebook, it does say Shining Light, just because, like I said, I work for the government as well. And so I do want to have a little bit of privacy like everyone else. And so I do not put my real information, my real birthday on Facebook for certain reasons, right?
no, I got you.
But I am a nurse in oncology, and
But
I
is that your real
enjoy.
name, ShiningLight?
No, my name is Nelly. My last name is Zarate, like with the Z,
Oh, so
kind of
in
like
other words, I've been calling you this last name, telling everybody you're probably Native Americans of some sort, and that's where you got your name and shit. And
I'm
I'm
sure
wrong.
we all have something in some Native American in ourselves, right? If we dig,
See, I've been talking
we will
shit
find
about
it.
you. All right, all right.
So
So
yeah,
tell me,
no, just Nelly.
yeah. So tell me, Nelly, how did you get into oncology? How did we meet? First of all,
Well,
it's
you
a
and I
long time
met,
ago,
I
but
think in 2011 or
I know it's crazy,
2012
huh?
when I graduated as an LVN, and I went to get my IV certification from you. And since then, I actually got several jobs in different places, but I ended up in oncology, C-Care, which is associated or affiliated with St. Agnes.
Right.
And I started working there at the lab and then learning oncology
Really
and
working in the lab?
Mhm.
What'd you do in the lab? You just draw blood for them?
blood, med report, giving fluids, IV fluids,
Did
just
you do
whatever
that
was
as an
within my
LVN?
scope. Whatever was
Wait.
within my
Hold on, hold
scope.
on. So I gotta stop you. You mean LVNs can access central lines, Nelly?
Yes.
Oh my God, I didn't know that.
Mhm.
Because you know people talk shit about LVN.
Yeah, I know. They can do a lot of things as long as you get the proper training and you get checked off as part of
Right.
your skills, competency skills at work. You can do a lot of things. But definitely, yeah, that was my main job. And I got very curious, seeing the infusions, and I just wanted to keep on learning. And while I got my LVN, I continued to do prerequisites for RN. And fortunate for me, I got into an RN program and I became an RN in 2018.
Which RN program did you go through?
I ended up going to West Hills.
Oh yeah, I like that. I just talked to, I think her name's Catherine. Don't be mad, one of you ladies. Do you know who she is?
Well, I know a lot of people, but I
I think I don't know, her name is Catherine DeFedi. I don't know if I'm
Oh,
saying her
okay.
name right.
Yeah,
She's
Mrs.
like the big
DeFady.
boss.
She's the
The f-
director.
is she
Mhm.
director? And then I don't know who this is. Trina Shiloh. Trina
Mm,
Shiloh. Because I'm trying to get them to do IV therapy out there. Because I'm part of what's called the Association of Vascular Access and Infusion Nurses Society, and they came out with a study showing, which we already know, that 80 to 90% of registered nurses get zero training or very little training in nursing school. And then they come out and they stick a patient, and they wind up sticking patients 20,000 times. And like you, ask Michael, ask Pete, why don't nurses use their Mediports when they have them? So what do you feel about that for nurses who have a cancer patient or oncology or in hematology, which you taught me? What would you say to those nurses who don't use those ports because they're uneducated or incompetent and they're hurting their patients?
honestly, I think it comes to policy in their facilities. Number one, the people are afraid to ask if, it is within their policy or within their scope. It is definitely within their scope of practice. But I think because it was not part of maybe their competency checkoff list,
Do we really
they
have
feel
a
like
competency checkoff list?
I do have a competency checkup list. I feel like maybe because it was not in there, they feel like they should not be accessing that. And, as we learned in school, they always tell you be very careful when you access a central line because the patients could be a higher risk for
Right,
infection.
right,
And so the last thing somebody wants to do is to give a patient an infection if they're not feeling competent at that moment to give that, or confident, I should use the
right.
word confident to do it.
Both competent
So,
and
but
confident,
are
both.
they
Yeah.
capable? Yes.
Yeah. Well, I asked Michael this, and because you know me, I'm like the policy guru and stuff. Like I love policies because that's what keeps us safe. But how many facilities do you think have policies that say nurses cannot access a central line?
None. Probably
Right.
none.
And so I want to go back because I'm pick up on a word that you use, and I'm not picking on you on purpose. But you said they have to ask. They don't have to ask shit. Anybody can go into the damn policy thing and read the policies and find out for themselves. Because I don't trust, I know it's terrible thing to say, but I don't trust managers, directors, charge nurses, because they'll tell you crap that's not true because they haven't even read the policy. Now, you
Right.
said you work for the government and Kaiser. How many policies have you read since you've been there? I'm going to put
Honestly,
you on the
not
spot.
too many.
See what I mean? And you're a
And
typical nurse. Most nurses
yeah,
won't do it. So
not
it
too
blows
many.
my mind, though. And how long have you worked at each place?
For Kaiser, I've been there for going on 2 years,
See?
and for the government,
Right.
less than a year now.
I know, but see what I mean? But I mean, you've been there long enough that if you would have read one policy every day you went to work, just one, you probably would have read the whole manual already.
Right. And
And you
believe
don't
it or
have to.
not, there are some people that actually would tell you everything because they read it. And that's wonderful. Yeah.
I
And
eat,
and
sleep,
I'm
and drink
glad.
that shit because I use it to mess with the management.
And so, and another reason I think because some of us, I'm going to excuse or justify what I don't read the policies, is because we are not given the enough time. You like to get your training, your orientation, and then you get your badge, and then you go to work, and then that's it. You're on your
Oh,
own.
so I'm glad
So,
you.
do you have time to go read all
Yes,
the policies?
yes, I
No.
make time. Yes, you do. That's an excuse.
But you make time.
Yeah,
You said it. You make
yeah.
time.
Excuse.
Everybody is different.
I know, but
Yeah.
excuses are like assholes, Nelly. Everybody's got one, and they all stink.
Yeah, we all have an
But
excuse. That's
But
for sure.
it's true, it's true. But you said though, I'm on a big kick right now with the word orientation.
Uh-huh.
What is the difference between orientation and training? Because they're not the same and we're
No.
being misled as nurses. What is
So
orientation?
orientation, you are going to get oriented to your facility, where things are at, your supplies, and the people that you will be working with.
But you're
The
not getting what?
training, the
Right.
training is different because training is specific to what you will be doing.
And
And most,
how many facilities
not,
provide training?
not too many.
So
You might
then
get to shadow a person, for a few days just to do your competency checkup list.
right.
And once you complete that, you're on your own.
Do you think that's good and safe for patient care?
Honestly, it depends on the
You're so
experience as
politically
well.
correct.
I think it depends on the experience
Yeah, but we get a lot of new grads right now that are coming in that have no what?
that they don't have the experience. But I also think besides the experience, there also comes the skills.
Right, but
Like
how
if
are they gonna
you,
get the skills if they don't get trained by somebody to get those skills? Because
well,
a
when
lot of
you,
schools didn't give that training, proper training.
Perhaps not. But I think also if you teach one and you do one and you do it right on the first time, as a nurse myself, I could be like, I think you're good, you're on your own.
But do you know that's evidence proves that that doesn't work very well anymore? Do you believe
Uh,
that? That military government
how come?
training. I'm just telling you, evidence is proven that that's not 100% efficient anymore.
Well, I haven't worked with any new grads recently, so I
Right.
really can't
So,
testify to that.
so the reason why is because most nurses, what is the average age nurse right now?
I don't know, Kevin. I mean, I
50 plus years or older. And
okay.
I have a friend who just went to St. Natty. She just finished her orientation. She's 50 years old. Don't be mad at me out there. Don't listen to the podcast if you don't want people telling me your age. I won't tell you her name though, but she graduated at 50, and adults like us over around 35, 40, it takes you at least 3 to 7 times for things to click on average. I'm not saying every adult because everybody's different, but does that make sense? And everybody learns differently. Do
Yeah,
we
it's
take
true.
so like you're in school right now as an MP, what are you going to become an MP for?
Can I say or not
Yeah,
say?
why not? Why wouldn't you? Of course. Why are you so not? Why are you so worried?
Uh,
Like, are you hiding from somebody?
no, just like in
Or
school,
you're
you
cut?
like everything that you see.
I don't scrutinize
And
nothing.
so
What are
right
they gonna
now for
do? You
me,
wait, wait. I'm gonna make you happy. Do you know what happened to a Kaiser nurse recently? Now I don't know what Kaiser she
oh,
worked at, but she won $41 million, Nelly.
oh
Did you hear
wow, that's
that?
wonderful.
Do you know why
No,
she won it?
why?
She worked in the NICU or the PICU. I can't remember. So to be fair, I don't know which one, but it was the NICU or the PICU. She was complaining to the management that there were unsafe working environments putting the patients at risk. And what did they do to her?
Probably laid her off or
They fired her.
um.
And so she sued for retaliation and she won $41 million. And I think more nurses need to speak up because why are we, look, you're so scared to speak up because you're worried that you're going to get your job fired or your license hurt.
No,
And
I'm not
it's,
worried about getting fired. It's just when you are in a position where people already look at your future also, they're already counting
I got you,
with
but what are they
you.
going to do to you? Who's going to mess with you? You tell me who's messing with
And
Nelly and I'll
so right
straighten their asses
now,
out.
I don't know where I'm going. I like
What do you want
everything
to
that I'm
do?
seeing.
What do you want to
Um,
do as an MP? Where do you want to go? First
honestly,
of all, let me ask you this. What program are you in? And then what do you want to be as an MP? What does your future look like to Nelly?
I am at Fresno Pacific.
Yeah, I like that place.
Yeah, it is a good
Yeah.
school. And so before I started to get more deep into the program, I thought I was going to stay in oncology
Yeah.
forever
Oh,
because
see,
I
that's
like
why you're
it.
scared to say anything because you don't want people knowing you getting out. There's nothing wrong with it. There's nothing wrong with it. Don't let them shame you. Keep going. What are you gonna do? What are you loving
And
now?
so right now, I don't know because I am learning so much. And, I am going to say that before going into this journey, I thought family practice or family medicine was very basic, but it's not.
I don't want to do family medicine.
It's
Is
not.
that
It's
what you want?
actually
I know,
a
because you
lot.
do a little bit of everything. But is that what you want?
Right now, I really like it. I'm enjoying it and
You
I'm
don't think you're
learning a
gonna
lot.
you don't think you're gonna get bored? Yeah, but it's one thing learning in a school, but then coming to the patients is different.
Well, I've seen so far and I've learned a lot of things that I didn't know.
But
Um,
like, what do you mean? Like, tell me something that you didn't know you learned. Don't be embarrassed. What is it that you learned? Like, oh, I didn't know that shit.
well, honestly, a lot of the skin diseases
Oh
and
yes.
skin that I kid you not, I have to look on the phone and I have to look at the images
Yeah, what's wrong with
and
that? That's
then
nice. Yeah.
yeah, but that's something I never had thought about it. And there's so many different types of skin diseases and treatments, and so that's
Now,
something totally new for me.
are you into Western medicine? Are you into Eastern medicine? Are you into both?
I think I'm into both.
Do you understand what I'm asking you?
Hmm.
Because I'm a big holistic kind of person. Like, I don't really like medicines. I think that we push a lot of medicines on the people. I'll pick on you as an MP, family medicine. I come to you and you tell me I got to do this, but yet you ain't even doing it your damn self and you just push pills. And I don't like that. Like, they always
Yeah.
want to push statins on me because I got high cholesterol. I'm like, I don't want to take that shit. So I know that
I've seen personally so far, everybody's different, right? But
Right.
where I've been, even talking to my family, they're like, "Oh, I want to go to that provider." Because a lot of the people that are patients that are there, they go and they have a plan where they're losing weight, their numbers are going down, their
Right.
A1Cs are going down, their blood pressure is being controlled, is
Are they
being well
pushing pills?
managed. Not 100%.
Right.
So we're
The-
pushing more the diet and the exercise
right.
and just kind of holding these patients accountable for that. And they feel like they have a big job to do, which is, yeah, it is their
Did you
health.
just say hold them accountable?
Yes.
I like that. That's good. So
And
let me
so,
ask you
yeah.
this, because you like family medicine and all this. You brought up the word skin disease. Are you going to get into aesthetics?
No,
Because I know you
no,
love your body. I know you love your face and your health. Are you going to be one of those nurses that start their own medical spa?
no, not right now. That's not in my, at the top of my
I
head
got you. I'm
or
just curious
priority.
because a lot of
No.
nurses do that. Would you do what you're doing, like a medical weight spa, something like that, to help people lose weight and control their diabetes? Or are you just into family medicine?
I think right now the family medicine, what I have been experiencing and witnessing, has been very rewarding because I've seen it's not like you said, we just don't give them pills and be like, see you later, right? Like
Right.
you're on your own, I gave you what you needed. It's more like, okay, well, here is the treatment, but we don't just give them pills. We also tell them part of your plan, we're also going to give you a diabetic meal. And guess what that diabetic meal is
What
the
is it?
meal that they're going to have, which is, they're going to cut back on their snacks. They're going to cut
Do you
back
do you,
on their
do you give them a meal
carbohydrates.
plan, like an actual plan?
Now,
You
I
don't
just
help
tell
them
them
prep?
we do. We just have them, follow basic stuff. We find out what they eat and kind of out of that, then we say, okay, what are the things that we can eliminate from there? Number one is the snacks and all the sugary drinks, right? That we
But
drink
how
throughout
do
the
you
day.
do it? Because you know people don't want to change. People don't change. I know you said you're seeing it, but a lot of patients are non-compliant, and we spend millions and millions of dollars on non-compliant patients. How is Nelly going to make patients compliant?
So patients that we have dealt with, they are more than willing to do it. And I've seen it when they come back and it's a couple pounds less. And so,
Something's better than nothing. And
and
do you
they
applaud
really
them on
like
that
where they
and
go.
praise them?
Oh yeah, we do.
Because
We do.
if you go to a regular physician, I'm not saying all physicians, but if you go to regular physicians, most of them don't have nurses in their office and they don't educate their patients. They have MAs in there, and MAs can't educate, which I don't understand why. I think it's crazy. And they just push insulin and pills and stuff. The patients come back and their blood sugar's still high, so they push more pills and more insulin. But they never sit down like you and say, "Hey, let me see what you're eating. Let me see what you're doing to exercise. Let me see how you're giving your pills and your insulin." They don't do that shit. And so
Yeah.
patients,
Right now, I think as a student, I have that advantage that I can sit down and talk
because you
with
care.
them
Yeah, but
without
you
rushing
care.
them.
Yeah.
I
So, but
care.
how are you going to do the same thing when you become a provider? Because I can tell you, when I go to the doctor, not my current one, but my past one, he literally touches me 5 seconds. Okay, come back and see me 3 months. I'm like, what the fuck? I'm spending all this money. You ain't even seen me and shit. Like, how come providers don't spend quality time with their patients?
I think it all depends on the facility. I think where I'm at right now, I'm at a good place where I see that. I see the
Is it
quality time.
is it a place that we know? I don't want you to, rat any place out. Is it a place? Is it government affiliated?
It is not government
Is it Kaiser
affiliated.
affiliated?
No.
Is
Mm,
it a local, what's the word I
yes,
want to use?
it
Is
is
it
a
a
local
local group?
practice.
Is it a practice or is it a group?
It is a group.
Like they have United Healthcare Centers, they have Adventist clinics. Is it something like that or is it an individual person?
Well, they do call themselves a group because it is a group, but it
Mm.
is owned by a family.
Oh, I like that. So it's family oriented.
Yeah.
Yeah, but that may make a difference though, because you do want to make money, but you also really want to help. Now, do they cater to a certain type of ethnic group? Like, is it low income or is it just anybody? Because there are some clinics like we have one here in Madera called Camarina Health, and they really target the poor Hispanic, the poor white. You know what I mean? They don't really cater
No,
to
they
everybody.
they right now they're still working and growing, but right
That's
now
nice.
we take
Do you know them?
whatever. Well, I just met them.
Oh, that's nice though. Do they love you?
So far, so good. Yeah,
And
I
and
have
they've
a good
asked you,
impression,
and they've
and
asked you when you graduate to stay there.
it's a possibility.
Oh, that's nice. That's good. I like that. Don't be shy. Don't ever be afraid of making choices. You remember, who do you have to take care of first?
All right, and just me.
Yeah, I mean, so you don't be ever be afraid. There's nothing wrong with that. But see, this is what I talk about. I'm being sexist now, ladies. So Don't be crazy. But see how women are so worried about telling people what they're going to do because they don't want to be shunned or think they feel like they're letting their team down. Like fuck them motherfuckers. You got to take care of yourself. I know, but see, what's your husband say?
Whatever makes me happy
See,
because I'm the one
yeah,
who's going to do the job.
yeah, I like that guy. See, that's what
Yeah.
I say. What's your
Yeah.
husband's name?
Arnold.
Thank you, Arnold. Tell her to be quiet and just make herself happy and stuff. That's nice. I like that. So tell everybody what we did this last weekend about the Oncology Symposium. I think that's what it's called. Correct me if I'm wrong. It's called, don't tell me, California Central Valley Oncology Nurses Society.
That is correct.
So how did you get involved in there? And tell me why you decided to put that on. Because I like the tumor lysis syndrome. That was awesome. I like what was the last one? The von Willebrand disease, even though I
Uh-huh.
couldn't hear that lady very well. I liked
Right.
it. So talk about that.
So the way I got involved into this was because I like to learn. And so, as you know, I've gone from being an LVN to an RN. Now I'm back in
Soon the
school.
MP.
And so let me tell you, I have biological science and
Oh,
associates
shit.
in nursing. I have a bachelor's degree in professional development
Look at you.
and advanced patient care. I have a bachelor's degree in nursing, and I'm going for my master's.
Hey, look at you. You're
So
like
I
me. You
do
like to
like
go
to
back to
learn.
school. Yeah. That's good.
And because I like to learn in oncology, there are so many different drugs, so
Right.
many.
Right.
And so they do have educational dinners. Most of those dinners are sponsored by pharmaceutical companies.
Like the one that Michael was talking about, right?
Yes.
Yeah.
And so started going to those meetings because I wanted to learn. And so just learning a little bit here, a little bit there. And in one of those dinners, we have a certification in oncology, just like,
Right.
other fields that they have to get specialized on something and they have to get a certification. So through that, they also have a membership, and I got the membership, and they also offer educational dinners as well. And so I became a member and I started going to their dinners. And in one of those dinners, Myra and I kept on going to the dinners, and they approached us and they're like, hey, we're looking for somebody for next year, this and that. And we're like, oh, okay, well, that's
Sucker.
fine. But then I told Myra, I said, well, let's just do it. I said, we're here all the time anyway, so
Right.
why don't we just do it? I said, because to me, it's like when you have something in town and it goes away, then later you hear people complaining, oh, we
Right.
should have done something to keep it.
We're having that problem now with the Emergency Nurses Association here locally because nobody wants to come. Nobody wants to be a part of it. We can't even
Yeah.
get 4 people to the damn meetings.
Yeah. And so that is a shame,
Right.
because we are the Valley and I feel like we should be supporting each other
But we don't.
and praise each other
Right.
for the things that we do because we all do a good job in whatever field you're in, whether you're in ED, ICU, critical care, or oncology. We all give it all, even when we're there.
Right.
We're working hard, and I think we deserve to be acknowledged for the
Right.
things that we do. And we may not hear from our jobs, but we hear from our peers.
But if you hear from your peers that, we're not doing a good thing, I think it's shitty though, because, you're out there busting your ass to have these meetings and then nobody shows up. And then when
Yeah.
you're like, fuck it, I don't want to do this no more, they're like, oh, look at Nelly, she gave up. I know, but that's how they are, sons of
No,
bitches.
it is
Fuck
true.
all
I
you
mean, there
bitches.
is always opinions,
Right.
as you know. Use the example with my family. I'm like, when it comes to somebody helping you, nobody's there. But when you messed up, then everybody's there to give an opinion, right?
That's right. That's right.
So, and I use that example with my family because that's how it is. And unfortunately, that's how it is in most cases with the things that we do. But I didn't want the ONS for the Valley to go away. So that's why Myra and I kind of volunteer. And yeah, we got pretty much defaulted to be part of the committee. And so we've been running it now for a whole year.
Right. And it was
Um,
good. It had a good turnout. You probably had at least 80 people, I think.
yeah,
Well, 50 to 80 people, something like that.
yep,
I
it
hadn't
was
even had a
about
meeting
so.
that big. Well, I started
It
the
was a lot of work.
CVAN. Yeah, well, I started a group called CVAN, stands for Central Valley Association for Vascular Access Network. It lasted 10 years and they just closed down because they couldn't keep it up and running. And then I became the president of the local ENA for a year and nobody would come. So I'm like, I don't want to keep banging my head on the wall. People don't want to support. It just blows my mind that we don't want to support each other like that. So
Yeah.
I was
And
thinking,
so,
I was like, how the hell we get all these fucking oncology nurses here, but we can't get all these ER nurses here? Like, this is bullshit. So I'm
Kevin,
proud of you. You did a good job.
thank
Yeah,
you.
I think no, I really mean that because I think it's important because you know I don't mean to divert, but there's a lady I helped her and I became friends. She's in Texas and she teaches charting classes online and stuff. And she hasn't been in bedside for I don't know, maybe 2 or 3 years. And so I post her stuff. I'm gonna put this in the chat box so you can see what I took a picture of you. You're frozen and shit. I posted online her classes, the charting classes. And there's some nurse, I won't mention her name because she might listen to my podcast, but she's got her GNP. And she's like, I don't know. I don't know if I really think this is appropriate because this nurse has been away from bedside for 3 years. I'm like, who gives a shit? Like, she's been a nurse 30 years. Like, why do you have to stay in bedside all the time to be a nurse? I don't get that mentality. But a lot of people nowadays, there's a big push for some reason that says if you don't work at bedside, you can't be an instructor. How do you feel about that?
Well, I disagree with that because on my jobs, I should say, don't involve one job does, the other one doesn't. One job I'm all hands-on, bedside nurse. The other one I'm not. I'm all here. And so when people have that, I think why not give them the credit? And so
Yeah. That's why
and
nurses suck because we put everybody down. Like, what the?
and perfect example, I just had a meeting actually yesterday, and everything that I talked about before, it was talked about yesterday through other presentations. And it was like was already ahead,
Right.
but but it's like you don't have to be physically there,
Right.
but if you know it, if you have the knowledge and based on the experiences that you have had,
Right.
you can make great contribution to your
Right.
team and make wonderful things,
Yeah, I mean,
wonderful projects.
charting's charting. I mean, she's just teaching people how not to chart improperly or what not to say or how to chart so you protect your license. That's the name of her class, charting to protect your livelihood. So I don't understand why you. I mean, charting's been charting. Now the way we chart is a little different. I get it, but charting's fucking charting. So it just blows my mind how people. I don't know what it is. Do you think the program you're in, the FMP, is a DMP program? Are you going to become Dr. Nelly?
With my MSN.
Oh, you're doing
Are
MSN.
you hearing me now?
I am now. You said you're going to graduate with your MSN. Is there a reason why you didn't pick a DMP? Is it important to have a DMP?
It is and it is not. With this program, I will be grandfathered in, so I really don't have to get my DMP if I
But you will,
choose to.
won't you? I know you will.
I might. I'm
I'm
not
gonna have
gonna
to
tell
call
you
you
no.
Dr. Nelly and shit. Damn it.
I might, but I might take a break before I do that.
Right.
Uh, yeah, that's a possibility.
Yeah, I know
I
it is.
cannot
I know.
say no, but I would take a break before that. But
I
yeah,
just
I mean, the choice of a DMP and a MSN FMP, to me, it was what was available here. Some of the FMP programs that are available now are online, and I wanted a in-person
right.
program.
Right.
Again, because we go back to the basics where we have to learn the principles that have a strong foundation.
Right.
And I feel like, reading things online would not give me the same benefit as to being in person. And
Right.
so that's the reason I chose this program because this is hands-on in person. And,
I'm
if
glad
I
you
have
did that
questions,
though.
I can
Yeah.
ask directly to
Yeah.
somebody live,
Right.
not wait for 2, 3 hours or a
Or on
day
a
for
discussion board.
yeah,
Well,
exactly.
I get in trouble because there's a program, it's an LV to RN program in Florida, and a lot of these LVNs are doing it, and I don't really like it. I don't care so much about the didactic portion. That's a personal thing. But the problem is when they go to Florida to do their hands-on, they're going to skilled nursing facilities. They don't go to hospitals, they go to nursing homes. And so, as an LVN, if you're not in the hospital, you're in a nursing home, and then you go to school and get skills in a nursing home, how well are you going to be prepared to be an RN on the floor?
That's a tough one just because my RN, and I'm sure yours too, your RN program was different. You had to rotate to ED, to
Right,
surgery, to trauma, whatever
right,
level it was.
right,
And so, and you got to see all those things to the
right,
burn unit,
right,
and so pediatrics.
right.
And so it's a wonderful experience. And I think when you do that kind of program, you cut yourself short, very, very short.
Not just you. Who else are you cutting short?
Well, the patients,
Because
of
you're going to be
course.
on the floor day one. You're going to be like, damn, I didn't fucking learn this in school, Nelly. And now, what are you going to have to do as a preceptor or a mentor?
No, I get it. I mean, and that's
So
another reason as to why I chose the program that I'm in, because
I'm glad.
I
I'm
don't want
happy
to
for
cut
you.
myself short and I don't want to cut my patients short on what I want to deliver.
Now I'm going to ask you a controversial question, even more controversial. Should nurses who've been a nurse a year or 2 years, only as an RN, go into the MP program?
You know,
I got you on that one. Don't be shy.
that is a tough one for me personally.
You already know my feelings, don't you?
Yeah, and that's
What
totally
do you think I'm
valid.
gonna what do you think I'm gonna say?
No, you're gonna
Yeah,
say
because
no.
what do you know as a nurse 1 or 2 years? What do you know?
Well, and to be honest with you, sometimes you can be a nurse that has never had bedside
Right? That's what I
care,
mean.
you
Yeah.
know,
So look at you.
and
You've been a nurse how long?
a total for 11 years now.
And you told me that you're in the program and you're still what? Learning shit that you
I'm
didn't
still
learn.
learning a
That's my point.
lot.
And so can you imagine you're only a nurse a year or 2 years getting in that program? How do you think they would feel? How I know you'd be like, what the fuck? Really? Don't you think it'd be more overwhelming than what you are now? Do you feel
Uh,
overwhelmed at all?
oh, definitely,
See?
for
So,
sure.
and you're experienced and you're smart. So, I don't know.
It's
I just think it's
challenging.
crazy.
But yeah, no, I mean, I agree with you. I wouldn't do it myself. I think there is a perfect time for everything. For me, I think the reason I keep going back to school is because I get bored. And once I
Right.
get bored, I want to
Right.
do something else.
Me too. I think that's every nurse has ADD. That's why we get bored so easy.
Yeah.
So,
And so I
so
just want to learn
that's why I named my podcast Transformation Nurse Academy because I'm all about what?
transformation.
Yeah, because I think that nurses, if you get bored, nursing's so vast that there's no reason you can't transform yourself into being a better nurse, but doing something. I don't know if you remember you were in class, but I have a motto where do you want to be a good nurse or you want to be an excellent nurse? And I always ask that. I want to be an excellent nurse. So I'll ask you this because you told me chemotherapy, there was a lot of medications. Should a nurse have a drug book?
I think so.
So why when people come
And
here
if
and
you
ask,
wait 1 second, can you pause it? I'll show you what I have.
yeah, I'll wait for you.
Yeah. Okay.
Yeah.
Let me go get that.
Oh shoot. I'll wait for you. Nelly's leaving me, everybody. You're not mad at me, are you, Nelly? So I'm gonna be messaging Steven here. Hey, would you like to be interviewed for my podcast? Question mark. I would love to have you on. So we're on Facebook discussing the Community Regional Medical Center will close the PQ unit permanently. Um, I won't tell you who she is, but she's on here saying that Valley Children's Hospital will now accept community's insurance. So all that fighting back and forth to split up, now they're going back to where they were to begin with. It makes me crazy. Sad for our community, huh?
All right, Kevin, are you ready?
Yeah, I was talking shit while you were gone. So
Okay.
I won't tell you her name, but she's on Facebook. She said, I don't know this to be true, but she said Valley Children's Hospital will now accept community's insurance. So all of
Oh,
that fighting and shit from Sante Group and all that, where they split up. Holy shit, look at that. It's blurred, but I can see it. Yeah. Oh, look at that shit. That's a big ass pile. Is that drugs? Holy shit, that's a big binder. Is that all your drugs? I know Nelly's frozen again. We need to take up a collection for Nelly so she can get better internet. Did you hear
all
me
right.
talking shit?
Yes, that you need to do a collection for me for my internet.
If you look in the chat box, these are all the screenshots I'm taking you when you freeze. Holy crap, look at that. That's more drugs?
Yeah. So I
So
started a second binder because I couldn't fit no more in that one.
so do you think I know you're doing it because you're an MP, but don't you think
Oh no, that was before I even thought about being an MP.
oh shit. See, so I don't understand why nurses because I ask this all the time, like, the IV class, I make them bring a drug book. And they're like, "Why do I need a drug book?" I'm like, "You're a fucking nurse. Every nurse should have a damn drug book." Well, we have the pharmacy. Well, you trust the pharmacy? Like, I don't understand why we don't understand our meds because I think it makes you a better nurse if you understand how your meds work and why they're doing what they're doing. So I just don't
And
get
then you
that.
can ask questions,
Right,
educated questions, right?
right,
Because then you read and you understood certain things, and then you are asking, why is this like that? I just want to understand, why is it different than what I'm reading? Or could you help me understand?
right,
Because I read it and I understand this, but I see this.
right. See, that's what I say. I don't understand why that's so hard. I like that. I'm gonna have to steal your binder now. So let me
No.
ask this. I'm gonna go off into a deep end because I do focus a lot on implicit biases, culture, things like that. You correct me if I'm wrong. You're Hispanic. I know you don't like to talk
Yes.
about it because you're like, I don't
Oh,
want to
no,
just.
no, I
All right.
am Hispanic. Yes.
So, as a Hispanic woman, talking to young Hispanic women who aren't in nursing, who are nursing, what can you do to encourage them or give them guidance and feedback to get where you were to get to where you are now? What would you say to them?
Honestly, I'm gonna be honest with you, Kevin, and I wish there were more Hispanic nurses
Yes, only 6% in nursing.
because there's not a lot. I'm where I work, I'm
6%.
the only Hispanic
6%.
at Kaiser. I want to say there's more, but yeah, there's not that many, and I wish there was more. I wish I have motivated some of my family to go back and to get their degree in whatever it is that they have, they already work on. But yeah, I mean, I think it's doable. You can do it, but you have to really put your mind and your heart into it to do it.
But what would you say to motivate them?
To
I don't know if I can do it, Nelly. I'm not smart. I know, but that's what a lot of people say
Well, I
because we don't
honestly,
give them encouragement. So,
no, I agree, but I also feel like from culture, wise, that we always believe that as long as we're better than our parents, we're good, and that is not true.
right.
I think that we could do anything we want to, but we really have to work for it.
Do you know what I changed my mind? Because I used to have that same mindset. I'm not Hispanic, but I had that same mindset where I wanted to do better than my parents. But there was a switch that turned on about 10 or 15 years ago. I wish it was sooner. I don't want to do better than my parents. I want to do so well that I can help my kids do even better than all of us. And I want to leave a legacy for them. I want to leave them on a solid footing to be a good person, to be financially set, emotionally set. That's my mission is going forward in life to have that mentality. And not just me, anybody around me. Because, I'm a nut, but I try to motivate people.
I think it's great. I think when you work so hard and you surround yourself by others that look up to you, like your children, they feel like they really have to push harder than you.
Right.
And I'm in school with my kids as well.
Oh,
My daughter has a semester left at Fresno State, and my son is going to Fresno City. So all this week we were studying for finals.
all right. And
So
they
we're
can't
pushing
complain because you're
together.
doing it too.
Exactly. So
Be
I'm
like,
like,
listen, bitches, I'm old and I'm doing this, so shut the hell up. I know you're not old, but you're older
we're
than they
all
are. But
going through the same pains here, so nobody can complain that,
that's
oh,
right.
my final's harder than
Right.
yours. It's like, no, we all need
Right.
to study, and we all need to keep pushing until the very last minute.
What are
So
they doing? Are they in the medical field or are they doing something different?
my daughter, she is majoring in chemistry,
Oh, shit.
but doesn't
Man.
want to be a doctor.
She's sick individual. Chemistry. Ah, she must
So
be super smart though. I know that's hard chemistry.
I give her a lot of credit. Chemistry is not my favorite at
Right.
all.
Mine
I
either.
just took chemistry because I had to take
Right.
chemistry, but I don't know why she chose that, but she's pushing through. And my son, he's doing mechanical industrial mechanics or something
Oh,
like
all
that.
right. That's nice. That's good. I know my 16-year-old. He said he wants to be a computer software engineer. I don't even know what the hell that means. So, but I said as long as you're happy and it makes a good
As long as they
living,
do something,
yeah, don't be a bum and stuff. So yeah,
just do something.
that's
Do
nice though. That's
something,
good.
and yeah. So yeah, I mean, but going back to motivating the Hispanic community, I just wish that as I get to be in this field, that I get to see more patients, including Hispanic patients, and that hopefully they notice the difference and they can encourage their own families to become providers. Just because there's a great need and there's always, cultural wise, we always have different beliefs, whether we
Right.
like it or not. It
Right.
is reality.
Yep.
We think different, and I can tell you the same thing to 10 different ethnic groups, and we're all going to take things so different.
That's right.
So
That's
it is
why.
important to
No, but
motivate.
that's why I talk about it because I can say whatever I want. Nobody's really going to listen to me. But I want to try to encourage people to be speakers to help our community because your community is still my community. But I want to find a way that we can all grow and help and encourage each other. So that's why I started doing this because, you know, I believe.
No, I agree. I
Yeah,
think this is a great way to, let people know what we do, why we do it, right? And to motivate others to,
did
continue
you
to make a difference.
do you like nursing for money or do you like nursing because you like to help people? I know you like money. Don't get me wrong, but because there's a lot of nurses who get in it for just the money.
Well, Kevin, before I was a nurse, I was actually an accountant.
Oh shit! Look at you. Look at that. That's
Uh,
just no one. Now I know where your daughter got her sickness from. And she, them damn numbers and chemistry and stuff.
so I was an accountant without a degree, but I was making the same amount of money with somebody with a degree because my husband was in the military and we had to move
Wait. Hold on. What branch?
the Marines.
All right. I won't hold it against him. Shit. If you were gonna say Navy, I was gonna make fun of his ass and shit. Semper
And
Fi,
so moving,
motherfucker.
yeah, moving was so difficult, and
Right.
that was the job that I could do. But I always wanted to go to school. I just couldn't go to school because we
Right.
had to move all the
Right.
time and the kids were small.
Right.
So finally, when we came to Fresno, it was more like thinking about retirement. And I saw the opportunity. Actually, when I moved to Fresno, I moved here from Hawaii.
Oh yeah.
I was a dislocated worker by the government because we had military orders to move here. So I became unemployed
Fucking Arnold moving your ass to fucking Fresno and shit. Thanks a lot,
because of
Arnold.
the order, because of the military
I
orders,
know.
right? And so because of that, I was unemployed. And while I was trying to figure out what I was going to do and all that, the unemployment offered me a training. And so the training, I had this little knowledge about nursing, but they said it's a CNA.
Right.
And so I took it and I went for that, but I learned quick that it was really physically hard for me.
Right.
And so I made a petition for all the students in my class to Workforce Connection.
Yes, I love Workforce Connection.
And so the Clovis Adult School before used to have just one LVN program. And thanks to the petition that I made and the money that was provided from Workforce
I
Connection,
love it.
they were able to get accreditation for a second program.
Mm.
And that was our program. And that's how I became an LVN.
So will you
So I
help
am
me?
here. This is my passion. I like
I
it. I
love it. Yeah.
love school. I do miss the numbers, the accounting part,
You
but
sick individual, you. Mm. You
but
can
I
still
like
do
this.
numbers in healthcare.
Yes, I still do
Yeah.
numbers, and I tell you, my other job is about other numbers and other
Right.
things and projects that I do
Right.
that are, in regards to nursing, but I can put things together.
Right. So will you help me then? I didn't know that about your Workforce Connection because we have our adult school here in Madera. We don't have any programs left. They're just kind of falling apart. And I'm trying to figure out how to take over and help get that adult school back up and running for CNA programs, LVM programs, all different kind of medical programs. Will you help me with that? Will you show me what you did?
Well, I can show you what I did, but I was in the program and I just moved really quick,
I
typed
know, but
a
I mean,
letter and
yeah.
submitted it.
Do you still have that letter?
I can look. It's been, I don't know,
I know it's been
13
10.
years now.
I know. Do you remember what
But
you said?
but yeah, I
Yeah.
remember what I said,
Do you
and
remember who you went
everybody,
to talk to? Was it
I,
somebody at Workforce or was
yeah,
somebody at
somebody
at
somebody
the
at
program?
Workforce,
All right.
no, in the program as well.
All right.
So we have a different director now at Clovis Adult School, but
No,
the
yeah, I know.
director also moved
You
really
you
quick.
you had the old white lady, Mrs. Sharon, was it
Ross.
Ross? Yeah, Mrs. Ross. She's like a mean ass old lady, but she was smart. She would make you
She
do your
is
shit.
very smart, yeah.
Yeah. All right. I'm
So
writing this.
yeah,
I'm making a note here. Workforce in adult school, so I don't forget. Yeah, because I like our community, but our hospital closed, so we're kind of like falling apart and stuff over here. So I'm trying to do what I can to be part of our community and get us back up and running and stuff. So
I'm sharing my secrets with you. So
yeah, I like that though. That's good. See, I like that. I can learn something. All right, so I know we've been on here a little while, so let's wrap things up. Tell people what we can do to help you while you're still working as an oncology nurse. How can we support your organization? Is there, if you can, I don't know if you can like message me on the messenger and Facebook. Give me some links I can send people to because Jane, who we talked about, she'll put them on the podcast and so people can click on the links. How can we support you?
So number one, for all those nurses that are interested in oncology, they do have to be oncologist certified. So they go through the ONS certification. We are a local chapter for the ONS. We're the Central Valley Oncology Nursing Society. They can become members. And we are actually next year, we're looking for somebody to join and be the secretary of the
Okay.
chapter. We would like to have somebody computer savvy and
All
all that
right.
good
All
stuff.
right.
Just because we nowadays with technology, we can do many things, right? And great things.
Yes,
And
that's
so
right.
we have to keep up with technology.
I'm just writing notes while you're
That's one way that they can support our. Yeah, where I'm talking.
Well, I'm writing notes
That
in
they
the
can
chat
support
box so
our
Jane can put all
association.
this in there so I don't forget and stuff. So you
Yeah,
want a secretary and someone who is computer savvy.
correct.
All right. So what website can they go to? Oh, I asked Michael this, but he wasn't 100% sure. So you said they have to have a certification. Is it like me? I'm a certified emergency nurse. It's a national certification. You have to sit for the exam, and it's recognized nationally. Is the ONS certification the same thing? You get
They
to use
have
the title behind your name, or is it just so you can give chemotherapy, or do they have both?
you can use the title on your name, but you do have to have certain hours first in oncology to apply for the certification.
But how do you give chemotherapy without a certification?
Well, you start to shadow the people that you work with, right? Because when you start, you're not gonna know the binder that I show you that is
Right,
this
right.
big.
Well, I thought
So
that you had to have, I didn't call it certification, but I thought you had to have some kind of like a 8 or 20 hour class on chemotherapy drugs before you could actually start administering it. Is that
what they do,
wrong?
they do have some policies that you have to
Oh,
read,
okay. All right.
okay, on
I
how to
got
handle chemotherapy at work. They're not just gonna throw you out there and be like, okay, well, here are the chemo drugs. And they're not just gonna give them to you from the get-go because they're chemotherapy drugs.
right,
But they're going to show you the drugs and they give you, I think, up to 3 months for you to take the certification. But they are going to show you the most important things, which is safety, number one, how to handle chemo spill if there is one, which I've only seen one all these years, but it could happen.
right.
Once you do all that, then you would apply for the certification. It is online. You can purchase the online book or you can just buy it and then you just take the questions. And
So
once
I
you
can
pass,
take
you
it
get the certification.
online and I can do an open book test.
I mean, if that's what you want and it's going to help you, then yeah.
Damn, that's some bullshit there, Nelly.
But the
I didn't
questions are not easy, let me tell you.
I know, but I didn't get to do no open book test with my emergency nurse. They make you go. I had to go to. It was over in the hood in Fresno, and it was a little H&R block with 4 damn computer screens. It was 8 o'clock in the morning, freezing my ass off, and
This is for
no.
the fundamentals of chemotherapy, biochemotherapy.
But
So
is it a national certification or is it just
there
certification so
is
you can
there
give
is
the?
another certification.
So they're separate.
And the
I
other
got
one
you.
that you're
Okay.
talking about, it's like you're saying, you have to go to a facility and you have to test, and there is no book.
So the first one is what I was talking about, where you had to go get trained, you have to learn the medicine, then you have to take that certification so you can give the medications.
Hmm.
So if I started working with you, you said I got 3 months, would I be giving any medications during that 3 months with you by myself, or would I just be learning about the medications and watching you do it and then taking the certification test so I can do it on my own?
It will be with me,
Okay. I'm never going to be by myself for the first 3 months.
usually not recommended.
No, I know, I get it, because it's some crazy stuff that you're giving there. Because
Right.
don't be mad at me. I used to make fun of the oncology nurse because I used to say I don't want to work oncology because they look like a bunch of old ass ladies because they don't what,
Oh, wear the gloves?
and then they get chemo in their skin and their hair falls out. Because that's what the old oncology nurses used to do. They would never wear gloves and shit, and they'd empty the Foley and give medicines and get all that crap on the skin and make them look like they were on chemo and shit. You
Well,
still know some of those nurses, don't you?
I got to see,
What I'm talking about,
I
aren't I?
got to see something, but
Am I right?
yes, you are right.
See?
But nowadays you don't see that anymore.
Right.
I
Put your
did
damn
get to
gloves
see it
on.
at the beginning of my
Right.
career, but I haven't anymore. And so I don't know why. But
Because we
anyways,
were cowboys back then. Cowboys and cowgirls thought we were, invincible to every damn thing.
yeah, and I mean I totally get it, but I think and I tell people in my children as well, when you start something, if you want to do this career for a long
Right.
time, long term, you do have to protect yourself. Because
Right.
if
You
you don't
do.
do it now, later you're gonna suffer the
You're going to
consequences.
suffer
You
the
will see
consequence.
it. And so start taking care of yourself now, wear your PPE,
Right.
and then do what you have to do.
That's right.
Don't cut any corners. Just
I love that. Don't cut any
do
corners, people. You die when you cut corners. Or you're
no,
going to
don't
be
cut corners.
toothless or something.
No.
All right, Nelly, I appreciate you taking your time. I've took an hour already of your time, but I really appreciate you. Is there anything else you'd like to tell people before we wrap the show up?
Well, I just want to say thank you to all the people that showed up for the oncology symposium. It was really nice to
It was
see
awesome.
people. And
Yeah.
we are hoping that next year we get to do it a little better, more organized,
I
and
thought it was great. Better than
that we
anything
learn
we've
from
done.
our
Yeah. Yeah.
mistakes that, from this time, and hoping to improve next time. And hopefully we get a secretary next year,
We'll
and
put the word out. We'll get you a secretary.
I would love that. And
Yeah.
so, yeah, and yeah, we're looking forward to another year and to make things way better.
Perfect. You have a happy holidays, Merry Christmas. I don't know what you say. I don't know what's politically correct
Thanks.
anymore, but I
Merry
hope you enjoy
Christmas.
your damn Merry Christmas to you too. And fuck all you motherfuckers. I hope you have good holidays. Tell Arnold, even though he's a fucking Marine, happy holidays and shit. I was in the Army, Nelly, so we always teach each
I
other. So
know,
yeah,
military all
I
the
love
way.
it. I appreciate him, and I appreciate you taking your time. All right,
All right, Kevin, you
all
take
right.
care.
Thank you too. You have a great night.
Thank you, you too.
All right,
Bye-bye.
bye.
Don't miss out. Engage with us weekly, share your thoughts, and let's transform the nursing landscape together.